A pint-sized patient has arrived at Scott's Isleworth practice. Guinea pig Oreo, along with his owner Joanna and her dad Jeremy.
He fell off my knee, but I was only kneeling down and we think he's damaged his leg.
We're feeling a bit apprehensive, aren't we? But we want to find out what's going on.
Good morning, Joanna. Hi, Jeremy. How are you?
Morning, good, thank you.
Hi, Oreo. Hello. Such a beautiful boy, aren't you? I think he's the prettiest guinea pig in all of Isleworth. Would you agree?
Yeah.
Yeah. And he's got a little brother at home as well, isn't he?
Yeah, Captain Scott.
Captain Scott. That's a pretty cool name. Yeah, you can't really beat that, can you? Come on there, little Oreo. Let's go and have a little chat about you, shall we? Come on in the consult room. That's it. Joanna's normally a very chatty child, but she seems very quiet, very subdued. She's worried about her guinea pig. So did he make any noise when he slipped off your lap?
Yeah, kind of like a really high-pitched squeak.
Okay. Oh, that doesn't sound very good, does it? Okay, well, let's have a little look, shall we? So I'm just going to have a little feel of his back area there. Good boy. So far, so good. Not making any noise there. Hey, lad. Hey, good boy. Oh, wow. He's really passing quite a lot of poo, isn't he? Does he do this a lot at home as well?
Not this shape.
Wow. He's really going for it, isn't he? It's like raining guinea pig poo at the moment. Well, better out than in. Hey. Oh dear. So a guinea pig's leg shouldn't be able to do that. The fact that it can come out on the side like that. So I think there's something quite seriously wrong with that leg there, unfortunately. It happens all the time. So no one should feel bad. They're not like a cat that can spin around and fall beautifully on their legs. They just take the full impact on their legs. And unfortunately, I think that something has gone quite badly wrong in that leg, which is why he's cried out in pain. So what I'm going to do now is I'm going to take him downstairs. We're going to perform an X-ray. Okay. And that'll just allow us to understand exactly what's going on with that back leg.
Great. All right. Well, I really appreciate that.
Yeah.
Thank you.
Poor boy. You're going to say bye to Mummy? Yeah?
Wicks, Pix, come on. Come on, there's a good girlie. Is this all different, Pix?
In West Sussex, rescue dog Pixie is enjoying a walk with her new family before heading in to see Scott.
Right, almost at the top. Keep going.
The little pup belongs to expectant mum Katie, but it was her mum Daphne who first discovered the tough little street dog during a holiday in Italy. Daphne witnessed Pixie caught in the middle of a horrifying dog attack.
She was literally covered in blood. It was all over her face and coming out of her nose, out of her mouth, and she was just screaming, really screaming. Good girl. I was nursing for 40 years, but that was one of the most awful things I think I've ever seen, really. It was... I can't describe how bad it was. It was just terrible. The eye was bulging right out of its socket, the whole eye.
The badly injured pup was immediately taken to the local vets, where she underwent life-saving emergency surgery.
Pixie wants a tummy rub.
I know, look.
She loves her tummy rub, doesn't she?
Yeah, she
loves tummy
rub.
Daphne relayed details of the shocking attack to her daughter Katie back in the UK. And when Katie saw the pictures of Pixie, her mind was made up to adopt the brave little dog.
Me and my son were looking in my emails and we both fell in love with her. And we thought, if she survived this long, she's definitely worth the fight. And we'll try and get her over here.
You're such a good girl, you are.
The family then had to raise enough funds to bring Pixie back to the UK.
The moment that she was in my arms, it was just sheer relief. She put her paws onto my shoulders and she just snuggled into my neck. I was in tears because I didn't think she was coming, and she curled up and went to sleep.
She's a lovely little dog.
But Pixie still has a tough battle ahead. The dog attack has left her with serious ongoing issues.
Both of the eyes are weeping.
Are they?
Yeah.
Oh, gosh.
We know one eye she definitely can't see out of, and we need Scott to see how much she can see out of the other eye as well. And the other problem we have is if she's in a new place, until she knows where she's going, she walks in circles and she bumps into things. When she gets discombobulated, that's what she does. Come on, Pix.
Katie is hoping Scott will be able to help her brave little rescue dog.
Although she's only been with us 5 weeks, she is a massive member of our family. Her personality shines through, and it's making sure that she is happy and healthy.
Come on, good girl.
And having seen Scott and the work he does, it's in his hands now. Pixie!
Come on, come on.
Back at the Isleworth practice,
Hey, Gina.
Scott and
Little
vet nurse
Oreo
Gina
here.
are about to x-ray guinea pig Oreo's broken
Such a
leg.
cutie.
What happened to you?
Problem that happens up and down the UK on a regular basis, that these little animals get hugged within an inch of their life by their usually young owners. And sadly, this guy decided to leap off little Joanna's lap and has definitely injured this back leg. So you can see that's far from normal.
Yeah, yeah, I can see that. We can fix it, can't we? Can't you?
I think so. I think we can give it a good go, definitely. All right, let's go through the x-ray. All right, so let's put our little man on the table.
An old glove box is used to hold the little pet still enough for the x-ray.
Good boy.
He looks quite comfy there.
Yeah. X-ray. Oh,
Ouch.
it is very significantly broken leg. That looks like it would have hurt a lot, but he has fractured his femur. It's a break right through the middle of the thigh bone there. So we're going to need to perform surgery on this boy and try and fix his broken leg. You've been incredibly brave, haven't you? Hey, poor lad. Looking at this x-ray, it's very clear that Oreo has likely been in quite a significant amount of pain. Breaks right there. Oreo is safely under anaesthetic. He seems to be responding well. I can hear his lovely heartbeat in the background, which is making me feel happy. So now it's just about getting on with the job at hand. Let's wake this boy up, shall we? He's off already. Good boy. Come on, let's go. Good boy.
Oreo will sleep off the anaesthetic before heading home later today.
There you go. Mummy will be back to pick you up very soon. Yes, she will. Yeah.
Come on, Pixie. Get that eye sorted out.
In St Margaret's,
Good
Katie
girl.
and 9-month-old rescue dog Pixie have arrived to see Scott.
Good girl.
Hello, Katie. How are
Hiya,
you? I'm
Pixie.
Scott. Nice to meet you.
Nice to meet you.
This must be Pixie. How are you? Oh, hello. Oh, that's
Apologise.
quite friendly, quite over familiar straight off the bat, isn't it? Hello. Hello.
She does love her cuddles.
Oh, even with a vet. Ooh. I think I see what the problem might be. All right then, shall we come into the consult room? Hey, you're going to give me a cuddle?
She will,
Oh.
she will give you proper cuddles.
Little Pixie, the little scruffy fur ball. Straight away, she gives me a hug, which is just absolutely adorable. 2 fluffy paws right around my neck. Loved it. This eye, Katie, tell me all about it.
So she got attacked by 5 dogs when she was a very, very tiny puppy. And the actual eye ball came out of the socket. So it was put back in with help of my mum and the veterinary nurse, my mum.
So no, let's stop you there, Katie. Her eye popped out of her head.
Yeah.
So she got attacked by 5 dogs.
Yeah.
And then so I came
Right
popping
out,
out.
yeah.
And then your mum leapt to the rescue.
Grabbed her, put a towel over her face, and they then took her to the vets.
But you don't seem particularly traumatised by the whole thing, do you? It really makes me feel desperately sad to think that poor little Pixie, at just 5 weeks of age, being set upon by 5 dogs and potentially suffering a lifelong injury. I believe she's a beautiful, special little creature that deserves a lot of love and a lot of treatment. That's exactly what I'm going to do. Let's have a little look underneath that unbelievable fringe you've got going on, haven't you? If you just hold around the shoulders for me, Katie, there. Let me have a look. I know your eyes had more attention than it ever needs, but oh my goodness. Looking at Pixie's eye, you can see, unfortunately, that it is what we call an end-stage eye. It's very small. There's a cataract that's formed within it. So unfortunately, the left eye is completely blind. Good girl. Let me have a look at this one.
No, baby.
Okay. That's good Does it always flick like that?
Yeah. And when she goes into somewhere that she doesn't know, she does circles, she bumps into things, and the perception isn't great. So worried about the other eye as well.
Yeah, for good reason. That is relentless flicking. Looking into the right eye, I was quite hopeful that this would be a functional, happy, healthy eye that was completely normal. Unfortunately, it isn't. So I just wouldn't mind plunging us into darkness for a second. Can you just turn the light off? So let's see. Good girl. So the back of the eye, the retina looks absolutely normal. There doesn't seem to be any issue going on with the eye. The concern I have is now two things. First of all, that flicking, which is called nystagmus, which does tend to indicate some sort of neurological injury, but also her pupil is only barely responsive to light. It's really upsetting and shocking to see we've got a left eye that's non-functional, and I hope that that would be my focus, but instead I'm more worried about the right eye. That's the only eye this poor little dog has left, the only eye that's functional, but unfortunately it's not functioning very well. Can we just pop her on the ground and just have a look and see what she does? I just want to see how she behaves on the floor.
Come on, Pix.
Oh, wow.
If she's in my flat, she's fine. She knows where things are. But if it's a new environment, that's when we have the problems.
Okay. That's not normal.
No.
It's really distressing to see the clinical symptoms that little Pixie's showing. She's a young dog. She's already been through a massive trauma with her eye, and now it seems she has this neurological issue. It's very sad. My advice here is that we send you to a specialist ophthalmologist who is a vet that knows lots about eyes, and they'll have a good look at Pixie and work out what, if anything, we can do, because it may well be that eventually you're looking after a blind dog.
Yeah.
A very beautiful blind dog, however.
It was very shocking. Wasn't expecting it, but she's a fighter. She's fought this hard for this long, so at least we can move forward in the right direction.
You know, as tragic as this is, the one benefit of youth is that she just goes, well, you know, I barely remember seeing, so actually I just get on with it. I love my new family, you know, and I'm going to make the best of it.
Good.
Pixie will be given medication to help with the nausea caused by all the circling, and Scott is going to arrange the specialist appointment.
She's beautiful. Yes, you are.
In Richmond, 4-year-old French bulldog Winston is coming in with his owner, Cara.
Hi, Cara.
Hi.
Hi. Hi, Winston. Hello, champ.
Winston is a popular visitor to the clinic,
There he is.
especially with receptionist Kirsty.
How's he doing?
So he's got a bit of an embarrassing problem.
Oh dear.
You might want to have a look at. It's not very nice.
Oh.
You're not looking very embarrassed, are you?
No.
Perfectly
Looking
fine.
gorgeous as always.
Yeah. All right, well, if you've got an embarrassing problem, we should probably go in private and talk about it, shouldn't we? Come on then. All right, you got him, Cara?
Yep.
That's it. Good boy.
He's kind of everything, really. He makes us laugh every day, and he's very popular, and he's very sociable and quite outgoing. And yeah, I love him to death.
So first things first, young man, embarrassing issue. I'm guessing it's the back end somewhere?
No, actually, if you get a bit closer to his face, I think you'll probably smell the problem.
Oof. Oof, my boy. Oof. Someone needs to brush his teeth. That is horrific. How long has that been going on for? Shocking breath.
It's been going on a few weeks now, and I've noticed some lumps in his mouth that's getting worse. So I just thought it'd be good to have you to have a look at it.
Yeah, okay. Can I have a little look in your mouth, my boy? Whoa! Whoa! Oh my God, that is horrific, isn't it? Wow, it's like his whole mouth has been taken over by barnacles.
Yeah, because he's got the bulldog chops. Until we pulled them back and had a look, we just didn't realise.
And they're even on this side too. Look at that. Oh my God.
I've never seen anything like it in my life.
Body.
When the vet says, wow, it must be pretty bad.
So basically what this is it's the papillomavirus, so
Right.
the wart virus that people have.
Yep.
Dogs can get it as well. And generally, it's only 1 or 2. You know, you
Yeah.
might get maybe 5.
Yeah.
And after a few weeks, it generally regresses, they fall off and it goes away. How long has this been going on for?
About 6 weeks.
Buddy. And he's such a tough little dog, this guy, so he wouldn't give much away, but when you open his mouth, I mean, that is so unbelievable, because one of those is actually just going right between his molars, which should just be so uncomfortable. It's not that unusual for young dogs to have warts develop, and they come and then they go. But this case is extreme and incredibly unique. For a dog to have that many warts present in his mouth, it's nothing I've seen in the last 20 years. We are going to have to perform a procedure on you, my friend, to try and debulk, try and remove some of them, and then use some medications to dampen down the continued regrowth of more.
Yeah.
I think the best thing for us to do is to have him in today, give him an anaesthetic, and then harvest, if you will, these barnacles out of his mouth, and start giving him the comfort that he deserves.
Yeah, no, that's great. Thank you very much.
All right, then. Well, do you want to say goodbye to Mummy? I probably wouldn't give her a kiss, though, because with that breath, she won't thank you for it.
See you later.
Okay, then, Carol. We'll give you a call once he's woken up.
Thanks very much.
All right.
Thanks, Scott.
See ya.
Cheers. Bye-bye.
Bye.
It's never nice. You never want your dogs to go under general anaesthetic, especially the bulldogs who can have problems with their breathing as it is. And I'm hoping that he's going to be all right. He's in good hands. And I'd be devastated if anything happened to him.
So now we're going to sort them out. Yes. Needs a special bit of equipment. Yes, we are. You ready for this?
Go on then.
Wow. Okay.
I've just never seen anything like it.
No, I mean, I've seen one or two, but that's like a colony.
Nathan's an experienced nurse, has seen a lot, and together we've worked on many cases, but we're both quite shocked by how severe Winston's wart problem is. It's been a really long procedure, way longer than I thought, because of just how many there were and how extensively they had spread. So he'll take a little while to recover, but actually I think he's going to feel a hell of a lot better than when he first went under. So it's a good result.
Winston will be started on medication to make sure the warts don't grow back.
I know. Oh, poor boy. Oh, no.
For now, it's time to sleep off the anaesthetic.
It's all right. I'll go and call your mummy. Good boy.
Come on then, let's go in.
In Isleworth, owner Joanna and her dad Jeremy are back to pick up guinea pig Oreo.
Hi,
Hey,
guys. How you doing? Hello, Joanna. You all right?
Yeah.
Yeah. So Daddy's told you what's happened today, hasn't he?
Yeah.
Yeah. How are you feeling about that?
Glad he's okay.
Yeah. Well, I think you're being very brave. So I just want to warn you, okay? Obviously, he's lost his leg, all right? What you got to remember is that animals aren't hypochondriacs, so he's not going to complain to you that he doesn't have a leg. He just wants lots of love and cuddles, all right? So here he is here. Where's Mummy? There he is. So let me show him to you. There you go.
What are those metal bits?
So they're called staples, and they're going to hold the skin together. And there's lots of stitches underneath to keep it all together. And in the meantime, he needs lots of love, and he will be able to move around. He just needs to get used to walking on 3 legs rather than on 4.
Yeah, I'm really excited to get him home and just cuddle him.
The staples come out in about 10 days. See, look, you can see him moving around there already. See, you're having a little run around. That's good. Oreo seems to be making a great recovery. He's already moving around the table, so he definitely seems to be back to his old tricks. All right then, Joanna, you give him a lovely cuddle. All right. There you go. All right, you look after your boy for me, and I'll see you very soon. All right?
What'd you say, Joanna?
Thank you.
You're very welcome.
Thank
see
you.
you later.
Thank you,
all the
Scott.
best.
All the best.
No
Cheers.
worries. Bye, guys.
I think Joanna's been very brave and said, well, if he hasn't got it, then he can't feel the pain. And, that makes sense. So, yeah, we're very pleased with the outcome. Let's go. You okay?
Over in Richmond, Winston's owner Cara has also arrived to take her French bulldog home.
I'm really looking forward to seeing him, actually. Hopefully he's not going to get too excited. I don't know how sleepy he's going to be, but it'll be lovely to see him, and he's normally super excited even when I've been away for 5 minutes, so I'm sure he thinks I've left him forever.
Hello.
Hey, buddy. Hi.
So what's the first thing you notice?
The smell's gone.
Exactly.
That's for sure. My
No
God.
smell. Woke up with lovely fresh breath, didn't you?
He'll be a lot more comfortable.
Yeah, absolutely. Look, let me pass him to you.
Yeah.
Let me show you some of my handiwork. So they were absolutely surrounding, smothering the insides of his cheeks. They're under his tongue, they're on his hard palate, and then also on his soft palate. You can see the difference.
Oh my God,
Gone.
it looks so much better. Oh, good boy.
There you can see a little bit of healing to do, of course. It was a thoroughly disgusting process, but I'm really glad all those warts have gone and he should make a full recovery and feel a lot more comfortable. Do you want to see them?
Definitely, I definitely want to see them.
They're totally disgusting.
Oh my God, looks like something from the bottom of the ocean.
It really does. So I was thinking
it's
that looks
horrific.
like barnacles, doesn't it?
And all that in his tiny little mouth.
Yeah.
Absolutely shocked by how many were in his mouth. We knew there was quite a lot, but I'm pleased they're now in a dish, not in his mouth anymore.
All right, buddy. You sleep it off, eh? Better out than in? Yeah. All right, good boy. All right, Cara, all the best.
Thanks ever so much.
See you later.
Thank you. Take care. Bye-bye. Bye, Kirsty.
Pick, come on. Hey, good girl. You're going to go with Scotty today.
In West Sussex, it's now the day of Pixie's eye specialist appointment.
Good girl.
But there's been a family emergency, with owner Katie going into labour.
You scallywag.
So her mum Daphne is looking after the little dog. And Scott has stepped in to handle the specialist visit.
I know that's the farm dogs, but you don't need to bark.
Hi there, you must be Daphne.
Hi, how
Hi,
are
I'm
you?
Scott. How are you?
Hello, good morning.
Hello, Pixie. Good to see you again, beautiful.
Oh,
How
gosh,
are
you do recognise him, yes.
Hello, baby girl. Speaking of babies, what a drama for you this morning.
know.
So Katie's in the hospital
She's
now.
in the hospital.
About to give birth at any minute. It's been a few weeks since I've seen little Pixie, and actually she's looking a lot better. She seems very bright, very happy and enjoying life. And I feel the anti-nausea medication that I prescribed has had a real impact on improving her quality of life. But she still has some very concerning neurological symptoms. The spinning and also the eye flicking seems to have maybe even got a little worse. So I'm really looking forward to taking it to the specialist today and understanding a little bit more her problems.
Say bye to Grandma.
Bye, darling.
All right, we'll see you later, Daphne.
See you
Take
later.
care. Bye.
So terrific help Scott taking Pixie for her appointment. And then hopefully we'll know what to do after that.
That's a good girl. Here we go. Here we are. Let's go and see the eye doctor. Come on.
Ophthalmologist Rob Lowe is handling the consultation.
Hi there, Rob.
Hi, Scott. Lovely to meet you.
Nice to meet you as well.
Hello. This
This
must be Pixie.
is your patient for the day. This is Pixie. She has quite a few fairly horrific injuries that she suffered in Italy, and unfortunately her sight is not great. So you're the man to see about that.
Well, hopefully so. Lovely. Right, if you'd like to come on through this way, we'll
Yes,
have a little
please.
look.
Great. Come on then.
Come
Let's
on
go.
then, Pixie. Good girl.
Good girl. I'm feeling a little bit of pressure right now because it is a first for me to be squiring a patient of mine through a specialist appointment, all the while the owner is trying to give birth in a hospital. So that's definitely a first for me. I just hope that I do a good job and that Pixie comes through it okay.
Let me have a little look at this eye. Well done. So just looking at hand movement towards the eye, as you appreciated, there's not much response to that hand movement, and yet she's quite capable of blinking when I touch the eyelids, which indicates that we've got a problem with the visual signal being sent up to the brain. So we're going to take a bright light and shine this into the eye now, and what we should see is a constriction of the pupil, and there should also be a blink response as well as the eye tries to protect itself from the external bright light. And we can see that there's no constriction of the pupil occurring, and there's no blink response, indicating we're lacking a dazzle response as well as a pupillary light reflex.
The tests done by Rob confirm Scott's suspicion that not only is Pixie blind in the damaged left eye, it appears she also has no vision in the right eye either.
Good girl.
Scott now wants to show Rob her strange circling behaviour.
It's a little like a whirling dervish. She just goes, and so it's particularly when she's stressed.
So she's circulating round to the right the whole time. There's no signs of her actually being able to turn around to the left.
It would definitely suggest something more central. No, that's not just a simple eye problem, is it?
No, there's something more going on.
Okay.
Having examined Pixie, we've found that she is unfortunately non-visual in her one remaining good eye, and we have certain signs such as the flicking of the eye from side to side and the circling, which suggests that this is a central nervous disease problem rather than a problem directly with the eye itself. Okay, little Pixie, you're going to come with me. We'll get you introduced to the anaesthetic team, get you anaesthetised and get your CT performed.
To work out what might be causing Pixie's behaviour, the little dog will now undergo a CT scan.
Great. All right. Bye, beautiful.
Yeah, well done.
All right.
Okay, we'll see you in a little bit.
See you in a bit.
Thanks very much.
Taking a CT scan gives us a 3D image of the brain and the skull.
Good girl.
The biggest concern would be is if we were to find some sort of growth, and that would be absolutely devastating. So I don't know what we're hoping for, but we're definitely hoping not to see that.
Okay, let's just slide you back a little bit.
Assisting Rob with the CT scan is Nurse Emma.
Let's get you settled.
So under the CT scan, we're looking to see if there's any skull abnormalities and any asymmetry. We're also going to be using some contrast to highlight any vascular areas within the brain which may indicate that there's a growth or something like that within the brain itself. Okay, oxygen's on.
Okay.
Okay, we're connected up.
Sending through, okay?
Okay. I just hope that this isn't going to be an ongoing deteriorating problem for her, and that's my big concern at this stage.
We're looking nice and straight there. Sending through, okay?
Okay.
In Hampshire, Pixie's undergoing a CT scan to shed some light on the damage caused by the vicious dog attack, which has left her with failing eyesight and odd circling behaviour.
How are you getting on?
Yes, well, we've got some great images through. Really now we just need to work out what's happened. So we've had a look at the skull, and if we do a cutaway of this 3D model here, as we look at this also in cross-section, we can see here that what should be a nice, bony, hard palate running in a straight line, pretty much back to this area and then forming the base of the skull. So lots of gaps within there, and it looks like it's been displaced up towards the brain as well. And then we've also got this advancement of bony-like material into the brain cavity itself. So there are a number of processes going on here which may well start to explain why we're seeing these neurological changes with Pixie.
So it seems like this dog has been bitten and that skull has been crushed.
Yeah, that's what we're seeing. This is more of a crush injury rather than a straightforward fracture, and that's pushed bits of bone in where it shouldn't go, and that's what's probably causing these brain injuries.
Does it surprise you that she's still alive?
Not only is she alive, but she's a happy little dog.
Yeah.
And that's just testament to how well dogs cope with adversity like that. Her eyesight isn't going to get any worse because, unfortunately, there is no eyesight left anyway, so she's not going to miss that any further. And in fact, what will happen is over the next couple of months, she'll spend quite a lot of time adapting further to that loss of eyesight. And that's what Pixie has hopefully got to look forward to, is that adaptation and getting back to a semblance of her normal life.
Come on, sweetheart. Good girl. Let's see it. Oh, poor baby.
While Pixie's blindness and brain damage can't be reversed, Scott's optimistic that a care plan can be worked out with her family that will give her a good quality of life.
This little girl is such a fighter. She's woken up quickly from anaesthetic. She's no worse for wear, and considering the extent of her injuries and just how catastrophic those changes are, what a plucky, strong little girl. So proud of her. So brave. Good girl. You have a little rest. Eh?
2 hours later, Pixie has slept off the anaesthetic, and Scott is returning her to Daphne.
Who's a good boy? Who's this coming?
Hi, Daphne.
Hi!
Look who I've got.
Oh, Piggy! Picky Wicky!
Here she is.
There she is, there's a little girl. Hello. There you go, Toby. I told you she'd be back soon.
She's been such a good girl today.
She
She's
is a
really
good
done
girl.
you proud.
She's
Yeah.
a very sweet little dog.
She's not only very sweet, but incredibly brave.
Yeah.
Certainly the images that I saw today were horrific. The trauma that she sustained from that bite really was beyond unimaginable.
Really?
Yeah. But there is some good news, because The fact is, you just wouldn't believe that's the same dog that has suffered this terrible trauma. She was lucky enough that this happened early in life, and she has developed through it.
Yeah.
She's never known a life any different from what she's living right now. The only issue that I have that we need to address with regards to your family is this. You feel that she gets worse when she's in a new environment, in a new situation.
Yeah.
I actually believe that it's anything that stresses her, anything that's different, change, all those things lead to that
spinning.
repetitive spinning, which is not in her best interest.
No.
On the drive back from the ophthalmologist to Daphne's house, I was deep in thought. I just was really trying to work out what's the best thing for Pixie, and coming back and being in this beautiful warm room and seeing the lovely Daphne snuggled up with little Toby, I knew what the answer was. Katie loves this dog, and I know that. But she's just about to have a new baby.
I know.
She already has children.
Yeah.
And ultimately, where is the best place for this little dog? Is it with Katie and her growing family? Or is it with Grandma, who is quiet and comfortable with a loving dog beside her, sitting beside a beautiful roaring fire? Daphne is an ex-ward sister, so she's very adept at looking after patients with complicated issues. And so I couldn't think of a more perfect owner for Pixie than that. She lives in a lovely environment. So really to have someone one-on-one focus on Pixie's best interests, I think is the perfect world for her.
She needs Toby as well for stability.
She's following Toby because she can smell Toby.
She smells Toby.
And to have a canine companion that can help her navigate this world, now we know that her vision is gone, is so important.
Yeah, I know.
And to have small children and babies and the noise and everything that comes with that, I just don't think it's the right thing for Pixie. And I think, despite how heartbreaking that might be for Katie, I actually think she wants what's best for this little dog. And I feel the best thing for Pixie is being with Grandma.
Yeah.
She's going to have the best life she possibly can. We're going to take her out and show her the countryside. Oh, yeah, she's going to have a good life.
Who's this baby? Who's that? Right. Here we go.
5 weeks after his operation, guinea pig Oreo is back with Joanna and Mum Rachel for a checkup.
Hi, Rachel. Hi, Joanne. How are you?
We've brought you Oreo back for his checkup. He's doing really well.
Yeah?
But it'd be good to know what you think.
Hello there. Now, this is the first time that I've met Captain Scott. He's quite considerably larger than his brother, isn't he?
He is. They started off the same. So it's hard to believe, really. But yes, he's thrived on us trying to get Oreo stronger.
Let's have a look. Hello, little man. How are you? It's amazing with the fur growing back. You really just can't tell that he's an animal with 3 legs.
No, and especially when he moves around, he's really good. You know, you wouldn't think he's being held back by the fact he's got 3 legs.
He's doing great. He seems very bright. So I think as far as, you know, amputated stumps go, it looks pretty good. Joanna, are you happy?
Yes.
Yeah?
Joanna's delighted with how well Oreo's doing. I think it's better than we could have all expected. And all her friends love to come round and to see him running around and doing really well and giving him treats. So I think it's been lovely.
And is he getting around okay? Is he walking around and chasing his brother?
I think it's the other way around. His brother's chasing him.
Oh, is that right?
He can put on a real spurt of speed.
Can he?
Yes, he can.
I'm very intrigued to find out because I'm very happy with the way he's gone. And my little namesake there, yes, he's a little podgy, so he could do with some exercise.
Yes, he definitely could.
So we've actually got this guinea pig exercise track. So we thought that we'd put these guys to the test and just show that just because you've got 3 legs, you can still beat your podgy brother.
Come on, Oreo. Let's see what you can do. I think it'll be really interesting because on a good day, Oreo could take captain, I think. So it'll be really good to see if he can perform today for us.
All right, well, should we put them in their little avenues?
All right.
Okay.
Come on, Captain.
Okay. How do you get them moving normally at home? How do you get them excited?
Oh, Captain, you know it, don't you?
A little bit of rustling, getting them excited. Okay, well, you keep rustling. Come on, Oreo. Get on your marks. Get set. Go. Come on, Oreo. Come on, Oreo. Look. Look.
You're a bit nervous, aren't you? What's happening?
Come on, this way. Come on. You're showing me up. Putting Captain Scott and Oreo in the guinea pig run and then releasing the beasts, they seem disinterested totally. They're barely moving, but I think it's just because they're a little bit nervous. Maybe they have a little bit of stage fright, but either way, I can see them moving a little bit, and certainly Oreo is doing really well. What's that? Oh, we're teasing him utterly, haven't you? No cheating. Come on, good boy. Let's see you moving. Good boy. That's it. Keep coming, keep coming. I don't feel that guinea pig racing will be a spectator sport somehow.
It's a little,
little dull.
Passive.
Yeah. The fact that he's moving, really well, he seems very comfortable, seems very happy, he's eating well, so I'm a happy vet.
Yeah.
Hey, come on, your rotund brother is beating you. Come on, come on.
We've definitely got a winner.
Yay!
Oh, Oreo gets it.
Yay! My vet clinic, my rules.
Yeah.
Okay.
6 weeks later, and there's good news all round from Pixie's family.
Hannah, Pixie likes flowers.
Does she?
Katie delivered a healthy boy named Harry, and her little rescue dog Pixie is now enjoying a much quieter life with Katie's mum, Daphne.
Vicky, come. Vicky, come. Good girl.
Pixie's doing really well now. She's not spinning as badly as she was. She's putting on weight. She's developing into a lovely little dog, which is wonderful.
It's also Pixie's first birthday,
Well,
and
this is a
Scott has stopped by
family
to help
scene,
celebrate.
isn't it?
Hello.
Oh, hello, guys. Hello,
How are you?
Katie.
How are you?
Good. Mwah. Congratulations. Here's this little man.
This is Harry.
Hello, Harry. Aren't you gorgeous? Hi, kids. Hello, Daffers. How are you, darling?
I'm fine.
You all right?
Yeah.
Mwah. Good to see you.
you.
Hello, baby. Hello. Toby. Hello, mates. Thank you very much. And the birthday girl. Hi. Hi, 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 hi. Today is an unbelievably special day because this gorgeous little dog who's had such a harrowing existence so far has made it. It's her first birthday. Well, Mummy really does well and truly have her hands full.
Yes.
So Pixie coming to stay here with Grandma in this gorgeous environment.
It's the right decision for her, and it's the right decision for us as well. Although we do miss her, we miss her terribly, don't we, Bobby?
That's the tough thing about being a dog owner, isn't it? It's just
Yeah.
like being a parent, you have to put them first, and the best thing
Exactly.
was for her to be here.
She fits in. She's just a member of our family. It doesn't matter if she lives with me, doesn't matter if she lives with my mum. She's a member of our family, and that's all that there is to it.
All right, well, I'd like to see this little princess in motion. Hey, should we see what you like taking for a little walk? Hey,
She
a
loves
little walk?
walking.
Does she? Well, let's have a look, shall we? Pixie, come. Hey, look. Well, that's awesome. Good girl. Pixie's case has been different from the usual. I haven't been able to pick up a scalpel and fix the dog. I'd say if I was walking in a park with a dog like this, I don't think people would know she was blind. Instead, this has been a case of support and of care, looking after a family and helping them through a tough time. And it's wonderful to have a day like this where we can all sit together, joyful and happy with the dogs that we love. It's very special indeed. Well, a birthday party isn't a birthday party without some presents, is it? What's in here? Look, this is for you.
Wow.
This is for you, yeah? And this is for your little brother. There you go.
Oh,
It had to be doggy.
yeah. No, thank you so much.
There you go.
Thank you.
There you go, little Harry. It's as big as him.
It is. There you go.
And this is for you, my little princess. There we go. Happy birthday, baby.
Here's to many more to come.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.